Good evening, everyone. I am Dr. Pooja Johari, your biochemistry guru. So, today we will be discussing the questions on biochemistry. Now, first of all, you should know what is the pattern of the questions, what kind of questions are asked in the exam. So today I have roughly made some 27 to 30 questions which are covering most of the important topics from biochemistry. Right. So basically the type of questions which are asked in the exam are regarding the rate limiting enzymes, regarding the rate committed enzymes. This is the pattern of the questions which have been asked in the exam for the from the last 7 to 8 years. Now all of you know that next and NEET PG, new pattern is coming up. So now the main focus is on the clinical questions also. So here I have made some of the clinical questions also. So let's start with the discussion of the biochemistry questions. Now see question number 1. A 4-year-old child with exercise intolerance. On investigation, blood pH is 7.3. Fasting blood sugar is 60 milligram percentage. Suffering from hypertriglyceridemia means the concentration of TGs is more. Ketosis is there, means excess ketone bodies, and lactic acidosis. The child had hepatomegaly and renomegaly. Biopsy of the liver and kidney showed increased glycogen content. Now, what is the diagnosis? Right? Now, if you look at the options, you can see that McArdle's disease is there, Cory's disease is there, Von Gierke's disease is there, Pom's disease is there. So, can anybody tell me what will be the answer to this question? Now see, the answer to this question will be Von Gierke's disease. The Von Gierke's disease is one of the very, very important GSDs, glycogen storage disorder. Now, what is the deficient enzyme in Von Gierke's disease? The deficient enzyme is glucose 6-phosphatase. This is the deficient enzyme in Von Gierke's disease. And if we look at the clinical manifestations and biochemical, what happens is glucose 6-phosphatase, if you see the function, it converts glucose 6-phosphate to glucose. But if this enzyme is absent, what will happen? There will be increased concentration of glucose 6-phosphate, which will be diverted to form more and more of lactic acid, leading to lactic acidosis, if you see, which is clearly mentioned here, lactic acidosis, increased concentration of lactic acid. Then if we look, this glucose 6-phosphate, since it will undergo glycolysis, it will form pyruvic acid or it will form acetyl coenzyme A. Now you know, increased concentration of acetyl coenzyme A will be diverted to form more of ketone bodies, so it will be ketosis. Similarly, acetyl coenzyme A is precursor for the fats also. So, there will be increased concentration of the TGs or hypertriglyceridemia will be there. And that is what the question says. Hypertriglyceridemia, ketosis, lactic acidosis, and on the other hand, the child had hepatomegaly also, enlargement. Why? Because it showed increased glycogen content. So the answer to this question will be C. It's a very, very important question. Now there are other options also. If you look at other options also, McArdle's disease. Can anybody tell me what is the deficient enzyme in McArdle's disease? The deficient enzyme here is muscle phosphorylase. Now, this confusion might be there in your mind because it is written with exercise intolerance, because if a person is suffering from McArdle's disease also, he will be intolerant to exercise. But the most important distinguishing feature from McArdle's disease and von Guericke's disease will be, in McArdle's disease, the color of the urine will be burgundy. Clear? This is the most important point to remember about this. Then Cory's disease. Cory's disease is also, if you remember the mnemonic A, B, C, D, E. Cory's disease is due to the absence of branching enzyme. Pomme's disease is because some part of glycogenolysis takes place in the lysosomes also. So in Pomme's disease, we can say the deficient enzyme is maltase, alpha 1,4 acid maltase, lysosomal. Right? So here the answer is C, von Guericke's disease. Moving on to the second question. A baby is hypotonic and shows increased ratio of pyruvate to acetyl coenzyme A. Pyruvate cannot form acetyl coenzyme A in the fibroblasts. He also shows feature of lactic acidosis. So which of the following can revert the situation? Now again, when this type of question is asked, we have to focus on the reaction. What is the reaction being catalyzed here? If we see the reaction is simply pyruvic acid is converted to acetyl coenzyme A. Right? Now remember the reaction. The name of the enzyme here is PDH, pyruvate dehydrogenase complex, which is again an example of multi-enzyme complex. Now if we look at the composition of this is the reaction. Pyruvic acid in the presence of PDH forms acetyl coenzyme A. This reaction is taking place in the presence of oxygen. Very, very important. And this is strictly a irreversible reaction. On the other hand, pyruvic acid is converted into lactic acid also. This is what happens in the skeletal muscle. And this reaction is taking place in the absence of oxygen. The enzyme is LDH. Now here they are saying, the question is, he also shows feature of lactic acidosis, which means that this reaction is not properly being catalyzed. That means pyruvic acid, instead of being converted to acetyl coenzyme A, is being converted into lactic acid. So we have to see which of the following can revert the situation. That means we have to focus here the composition of PDH, or what all is required for this complex. So always remember, PDH is an example of multi-enzyme complex which requires B1, B2, B3, B5 and lipoic acid. These are the 5 major components of PDH. And out of these 5 vitamins, the most important one is B1, which is thymine and which is present in the active form as TPP, thymine pyrophosphate. Why? Because this is the vitamin which is catalyzing the entire reaction. Because if you see the biochemistry of this reaction, pyruvic acid has 3 carbon atoms. Acetyl coenzyme A has 2 carbon atoms. 1 carbon is given out, which is decarboxylation. And since this reaction is taking place in the presence of oxygen, so the reaction is oxidative decarboxylation. And the coenzyme for oxidative decarboxylation is B1-TPP. Now let's look at the options. Options are which can revert the situation. Biotin. Biotin is B7, which is not a component even of PDH. It cannot be the answer. Pyridoxine, B6. Again, it is not there in the option, right? Free fatty acid has nothing to do with this. It's not a coenzyme, you know. So, thymine. Always remember, this is a very, very important question. It can be asked in so many different forms. So, thymine, whose active form is TPP, which is the most important coenzyme for PDH. This question can also be asked in the exam. The most important component, or you can say the vitamin responsible for cellular respiration, is TPP or B1. And it is seen that in B1 deficient subjects, the patients who are deficient of B1, they have lactic acidosis because the reaction is diverted to this side. So this is a very simple question. Answer will be D. I hope it is clear to all of you. Because whenever these type of clinical cases are asked, you have to simply go to the basics. It's not at all, difficult to understand. When you know the basics, you can easily attempt the question. Then question number 3, a heart patient suddenly has chest pain. Which isoenzyme of LDH enzyme is activated? Now, if we look at the LDH enzyme, you know what is the full form of LDH? It is lactate dehydrogenase. The full form of LDH is lactate dehydrogenase. Just now I discussed about this enzyme. This enzyme is a marker enzyme of cytoplasm. And it catalyzes one very simple reaction, pyruvic acid to lactic acid. And it has 5 forms, 5 isoenzymes, LDH 1, 2, 3, 4 and 5. Now all of you are familiar with the term isoenzymes. Iso means same. So isoenzymes are defined as those forms of enzymes which will catalyze the same reaction wherever they are present, because the reaction will be similar. Pyruvic acid will be converted into lactic acid, but there has to be a point of differentiation between all these 5 forms. So what is that? They are different structurally. This is very, very important. Structure wise, they are different. Right? Electrophoretically, they are different. And immunologically, they are different. Structurally, if we look at LDH1, LDH is actually a tetrameric enzyme. Tetrameric enzyme means it has 4 subunits. So LDH1 is predominant in the heart muscle. The moment we go down, the structures changes. And M4. If we talk about electrophoresis, always remember LDH1 is the fastest moving fraction. And LDH5 is the slowest moving fraction. And third point of differentiation is immunologically. Now, immunologically, LDH1 is a marker of MI and LDH5 is a marker of liver diseases. Always remember. Now, this is about LDH. Now, coming over to the question. The question says a heart patient suddenly has chest pain. Which isoenzyme of LDH enzyme is elevated? So, the answer is simply LDH1. Answer will be A. Now here one more question is there which is generally asked in the exams. In a normal individual, if we say normal individual में LDH2 fraction is more than LDH1. But in a person with MI, LDH1 is more than LDH2. And this is known as flipping ratio or flipped ratio. This is the question which has been asked in the exam so many times. So what is a flipping ratio? Flipping ratio is when LDH1 is more than LDH2. But here the question is clear. So you can say the answer will be simply LDH1. Then moving on to the 4th question. A 3-year-old child presented with swelling in the groin and defective vision. On examination, intellectual disability, coarse facial features, hepatosplenomegaly, prominent forehead and short stature is present. These are the clinical manifestations. An urine spot test for GAGs is positive. Now, this is again a very important biochemical finding of a patient suffering from mucopolysaccharidosis, GAG, glycosaminoglycans, and Hurler's syndrome was diagnosed. Now, which of the following features will be seen in the child as a characteristic feature? Now see, answers are progressive corneal clouding, dural calcifications, normal intelligence and stiffness in joints. Now always remember, whenever we talk about mucopolysaccharidosis, right, mucopolysaccharidosis is simple. It is a lysosomal storage disorder when there is an increased concentration of mucopolysaccharides in urine. Mucopolysaccharides are also known as GAGs, glycosaminoglycans, because of how they are formed. If you look at the structure of every mucopolysaccharide, be it chondroitin, be it heparin, be it heparitine sulfate, keratin sulfate, all of them have glycosaminoglycans, means a carbohydrate, amino sugar, and obviously a uronic acid moiety. And if a particular enzyme, if I say A plus B forms C, or if C has to be converted into A plus B, if the enzyme is absent, there will be increased concentration of C, which will first increase in blood and then it will appear in urine. Now, to remember this mucopolysaccharidosis, there are ideally 7 types of mucopolysaccharidosis. But the most frequently asked questions are on Hurler syndrome, Hunter's syndrome, and Sanfilippo's syndrome. And it is very interesting to know that all the different type of mucopolysaccharidosis have same clinical features. Skeletal deformities are there, copious nasal discharge is there, they have a prominent forehead, they have pain in the groins, but the most important distinguishing feature among all mucopolysaccharidosis, again I will repeat this, the most important distinguishing feature in all the mucopolysaccharidosis is vision. Very, very important. And again, there is a mnemonic for this. Always remember, the mnemonic is Sam goes for hunting. Now see, Sam can hunt only when he can see. Isn't it? Sam can only hunt when he can see. That means in Sanfilippo syndrome, Sam is Sanfilippo's and Hunter's is Hunter syndrome. So in Sanfilippo's and Hunter syndrome, vision is clear. Always remember this. No corneal clouding will be there in a patient suffering from Hunter's and Sanfilippo's syndrome. And in Hurler syndrome, obviously, vision will be defective. And if we look at the deficient enzyme, obviously, Hurler syndrome mein the deficient enzyme is L-iodouronidase. Right? In Hunter syndrome, it is iodouronate sulfatase. Because sometimes the questions are asked on the enzyme also. So since we are covering this topic, I don't want to leave this. Okay? And Sanfilippo's mein it is again L-iodouronidase. So, now coming over to the question is, which of the following characters will be seen in the child as a characteristic feature? So, you can say progressive corneal clouding because the child is suffering from Hurler syndrome. Just remember this. And remember the mnemonic. Actually, what happens is if you try to convert these, you try to make mnemonics on your own, this subject will be a very easier one. Because enzymes and all, you can make the mnemonics as per your suitability. ठीक है. So in mucopolysaccharidosis, remember one mnemonic, Sam goes for hunting. So you can say in Sanfilippo syndrome and in Hunter syndrome, the vision will be altogether what? Clear. Is it clear? So the answer is A. Then moving on to question number 5. A 63-year-old female patient is suffering from gout. She gives history of increased uric acid and takes allopurinol for this, which acts on enzyme xanthine oxidase and reduces uric acid levels. Now, the action of allopurinol is which type of enzyme interaction? Now see, again this is very simple. This I have discussed in my videos also. I have explained in detail what is the mode of action of this allopurinol. Now see, if we see this, what happens is hyperuricemia or increased uric acid. This comes from obviously purines. The degradative product of purines is uric acid, and the normal concentration of uric acid is 3 to 7 milligram per dl. And if you look at the degradation, what happens is purines are the nitrogenous bases. So whether it is AMP, whether it is inosine monophosphate, or whether it is GMP, they are actually degraded to form hypoxanthine. This hypoxanthine is converted into xanthine, and xanthine is converted into uric acid. So this is how the degradation of purines is accomplished. Here the enzyme is xanthine oxidase. Right? Here also the enzyme is xanthine oxidase. Now always remember, allopurinol is first of all a competitive inhibitor of xanthine oxidase. Competitive inhibition, we know that in competitive inhibition there is a competition between the inhibitor and the substrate. If there is one more question on that, we will be discussing competitive inhibition there also. So allopurinol is a competitive inhibitor. On the other hand, this is an ideal example of suicide inhibition. Now, why it is known as suicide inhibition? Because this hypoxanthine, when this allopurinol is given, allopurinol combines with hypoxanthine forming allopurinol hypoxanthine, and if it combines with xanthine, it will form allopurinol xanthine. And these products, whether it is allopurinol hypoxanthine or it is allopurinol xanthine, they are soluble in urine and they are excreted in urine. So that is what is suicide inhibition all about. Suicide inhibition को हम कैसे define करते हैं? We will simply say, first of all, the answer will be suicidal inhibition. And what is this suicidal inhibition? Whenever the inhibitor is combining, yeah, it is competing with the substrate to bind to the active site of the enzyme, it is going to form a more potent product. More potent product means it will be more strong, so that the original product which was being produced, it does not have any value. And that is what is seen here. Allopurinol hypoxanthine and allopurinol xanthine are much more potent than hypoxanthine and xanthine. Second is they are soluble in water and they are excreted in urine. So the moment concentration of uric acid comes back to normal, allopurinol has to be stopped. So the answer is suicidal inhibition. Then question number 6. All of the following are key enzymes in DNA synthesis except. Now a very interesting question and a very simple question. We know that DNA synthesis is also known as replication, which occurs in the S phase of cell cycle. So here, what are the important enzymes which are required? If you look at the enzymes, the most important enzymes are helicases, which unwinds the helix, topoisomerases, which relieves the stress and strain which is caused. Then during proofreading, exonucleases, ligases. The enzyme, now look at the options. Polymerase, yes, it is used. Exonuclease, yes, it is used. Aminotransferase, no. Aminotransferase, as the word says, there is a transfer of amino group. So obviously this is an exam. First of all, answer will be this. And aminotransferases is also known as transamination. And fourth is topoisomerases. Topoisomerases, yes, it is an enzyme of DNA replication. So the answer to this question will be C. Then moving on to the next question, which of the following converts acetyl coenzyme A to malonyl coenzyme A? A very important question and a very simple question. First of all, acetyl coenzyme A having 2 carbon atoms, malonyl CoA having 3 carbon atoms. There is increase, 1 step. So that means this process is known as carboxylation. Always remember. Carboxylation kiski? Acetyl coenzyme A. So the enzyme will be acetyl coenzyme A carboxylase. And always remember, I have mentioned it so many times, the coenzyme for carboxylation is always biotin, which is also known as B7. So wherever carboxylation is occurring in the body, the coenzyme will be biotin. Okay? Ab if we look at this reaction, first of all, the answer will be B, biotin. Now, can anybody tell me this reaction is what? This is the rate limiting enzyme or rate limiting reaction of lipogenesis. Rate limiting enzyme of lipogenesis is acetyl coenzyme A carboxylase. Is it clear? And the coenzyme required will be what? The coenzyme for carboxylation will be simply B7. Right? So the answer here will be, let me see, one student has asked me one question. Let me see. Yes, very good, Suvam. It is fatty acid synthesis, which is also known as lipogenesis. Clear? Now then, moving on to the question, next question 8. The amino acid which serves as a carrier of ammonia from skeletal muscle to the liver. A very interesting question and a very important question which was asked. Most of the questions I have picked from previous year question papers, and they are very, very important. First of all, you should know skeletal muscle to liver. Just remember, these are all the 4 amino acids, and the most important, potent glucogenic amino acid is, can anybody tell me the answer to this question? Options are alanine, methionine, arginine and glutamine. Chalo, I'll tell you, the most potent glucogenic amino acid is alanine. And the question is, which serves as a carrier of ammonia? alanine by a one-step reaction is converted into pyruvic acid. And obviously, this is a very, very important reaction. The name of the enzyme here is alanine transaminase, which is also known as serum glutamate pyruvate transaminase. Can anybody tell me this SGPT is a marker of which diseases? This is a marker of liver diseases. This is again one of the very important questions. So alanine is the most potent glucogenic amino acid because gluconeogenesis is taking place when? During starvation. So this alanine will be converted into pyruvic acid, and this is the reaction alpha ketoglutarate and glutamic acid. And this pyruvic acid now will undergo gluconeogenesis, forming glucose to give energy to the muscle. So the answer to this question is alanine. Right? Then moving on to the next question, which of the following is a rate limiting enzyme of citric acid cycle? Now always remember, whenever you are preparing for biochemistry, this is a piece of advice, you can just make a chart. On one hand, you can write the name of the process. On the other hand, on the right hand side, you can write the rate limiting enzymes or the rate committed enzymes. Because every year, one question is definitely asked on either the rate limiting enzyme or the rate committed enzyme. So here we are talking about citric acid cycle. So immediately if you have that thing, you can jolly well, answer the question. So the rate limiting enzyme of TCA is ICD, isocitrate dehydrogenase. Answer will be C. But since there are 4 different enzymes, so I will just focus on the other enzymes also. If we talk about phosphofructokinase, this is a rate limiting enzyme as well as a rate committed enzyme. Kiska? Of glycolysis. Right? HMG CoA synthase is for ketone bodies. Acetyl coenzyme A is for lipogenesis. बचा क्या? ICD. ICD is a rate limiting enzyme of citric acid cycle. So this is again a very important question, right? Then question number 10. Which of the following enzyme of gluconeogenesis? Most of the students get confused between gluconeogenesis, glycogenesis and glycogenolysis. Always remember, all these are separate terms. If we talk about gluconeogenesis, genesis माने formation. किसका फॉर्मेशन? ग्लूकोज का फॉर्मेशन. कहाँ से? फ्रॉम नॉन कार्बोहाइड्रेट प्रिकर्सर्स. So how do we define gluconeogenesis? Gluconeogenesis is the process of formation of glucose from non-carbohydrate precursors. And in glycolysis also, the 3 steps which are irreversible, which are obviously the regulating steps, they are also made reversible in gluconeogenesis. And there is one mnemonic called HUG. Just remember this mnemonic, HUG. It's a very easy word and a frequently used word. So you can remember this as a mnemonic. H stands for heme synthesis. U stands for urea cycle. And G stands for gluconeogenesis. Now these 3 processes in our body takes place in 2 organelles. And what are those 2 organelles? Cytoplasm and mitochondria. So always remember, whenever we talk about heme synthesis, urea cycle and gluconeogenesis, they will take place in the cytoplasm and the mitochondria. Right? Now here Question is something else. Here they are saying which of the following enzyme of gluconeogenesis is present in the mitochondria. Now can anybody tell me, because this is again a NEET PG question which has been asked in your exam. No one has answered. Anyone? Yes, Saurabh Yadav, hi. Can you tell me the answer to this question? Just give a try. Let me see. Very good, Jyoti. The answer is pyruvate carboxylase. Very good. And this is again a question which has been asked some 3-4 years back in your NEET PG exam. So always, yes, Priyanka, pyruvate carboxylase, and it is, yes, and this is the only enzyme of gluconeogenesis which is present in the mitochondria. Right, and I'll just show you the reaction also. Here what happens is pyruvate carboxylase, mane carboxylation means we are increasing one carbon atom. So this pyruvic acid is converted into oxaloacetic acid. So pyruvate carboxylase is the enzyme. Can anybody tell me the coenzyme? Just now I mentioned about the coenzyme. Carboxylation. Whenever a question is asked on carboxylation, just remember by default it has to be B7 or biotin. So you can see by this one question we can solve two questions, two answers. One is the only enzyme of gluconeogenesis present in the mitochondria, and second is coenzyme. Yes, very good, Jyoti, biotin. And acetyl coenzyme A is a positive allosteric modulator of this reaction. This is one of the very, very important anaplerotic reaction. Very good, Vishnu, right? So always remember carboxylation ke liye coenzyme is biotin. Rest, if you look at the other reactions, glucose 6-phosphatase in the cytoplasm, fructose 1,6-bisphosphatase again in the cytoplasm, and PepsiK again in the cytoplasm. So this is the only enzyme of gluconeogenesis present in mitochondria. And this mnemonic you have to remember: heme synthesis, urea cycle, and gluconeogenesis. These are the three processes in our body which occurs in two organelles. Then moving on to the next question, again a most frequently asked question in the exam. Fluoride inhibits which of the following glycolytic enzymes? Let me see. The answers are enolase, PFK, LDH, and hexokinase. What will be the answer? Just give it a try. Very important question. Anyone? Jyoti, Suvam, Priyanka, Vishnu? There is no harm in trying. Very good. Yes, fluoride always inhibits enolase. Very important, because the reaction, if I show you the reaction catalyzed by this is 2-phosphoglyceric acid will be converted into PEP. The enzyme is enolase. It is actually a dehydrating enzyme, because what happens is, all of us know that glycolysis, if we talk about the life of RBCs, it is 120 days. And suppose if a technician comes and collect the blood sample, immediately he has to, whenever he has to estimate glucose in the blood, immediately this sodium fluoride needs to be added along with an anticoagulant. Otherwise what will happen is कि glycolysis will keep on going, so it will give a wrong estimation of the amount of glucose present in the blood. So immediately this fluoride will be added, and it will block this reaction so that the technician can take the sample to the lab and he can easily estimate the amount of glucose in the serum. right? So this is a very important question, and this question can be asked in two types also. One is this is a direct question: fluoride inhibits which of the following enzymes? Enolase. Another format of this question is that if the blood sample has to be transported from one place to the PHC along with an anticoagulant, what is added? So it is always sodium fluoride. Hello Saroj. Right? So we are already discussing the 11th question. Okay? So the answer is simply enolase. Then moving on to the next question. A middle-aged woman presents to OPD with history of tingling and numbness in both upper and lower limbs. Fine. On examination, he was found to have a red fissured tongue, and investigation from laboratory suggested low level of glutathione reductase. Which of the following vitamin is deficient? Again, it is a very important question and a very simple question. Let me see who all can answer this question. Just give a try again. Yes, Vishnu, Saroj, Jyoti. Ab again, see, this is a big clinical, case. So normally students have a psychological, fear in their mind if it is 9 to 10 lines. So what will be the answer? Again, you have to search for one particular biochemical finding, which will be the answer to this question. A red fissured tongue, glossitis, cheilosis, these are the symptoms of which vitamin deficiency? I am giving you such a big hint. It is riboflavin, which is vitamin B2. Now, how you have to estimate? See, whenever we have to, carry out some biochemical investigation, we have to carry out the assay of the enzymes. So this glutathione reductase activity, yes, very good Vishnu, the answer will be B2, riboflavin. And always remember, it will be B2, not B12. For B2, the symptoms will be glossitis, cheilosis, stomatitis, and seborrheic dermatitis. These are, and corneal vascularization. These are the 5 signs of B2 deficiency. And how we estimate? We always estimate on the level of this glutathione reductase activity. So it will be less. Clear? There is one more question along with this. Glutathione reductase activity is reduced in B2 deficient subjects, and similarly transketolase activity is reduced in B1 deficient subjects, because transketolase is a very important enzyme of HMP shunt and which requires TPP again for its activity. Yes, it's okay. Right? So always remember, whenever we talk about glutathione reductase, always go to B2, riboflavin, and transketolase is always B1. Moving on to the next question, again a very important question. Hopkins colase test is performed on the proteins to detect the presence of. What will be the answer? Hopkins colase test is a specific test for indole ring of tryptophan. This I'll tell you, indole ring of tryptophan. Always remember, because whenever we talk about proteins, proteins are what? They are formed of the amino acids. So basically, the specific tests given by every proteins are biuret and ninhydrin test, whereas qualitative tests for amino acids are different for specific amino acids for specific group in them. Just as suppose if I talk about imidazole group, imidazole is present in histidine. Yes, very good Jyoti, the answer will be indole. And histidine के लिए या imidazole group के लिए specific test is Pauli's test. right? Indole ring के लिए the specific test is Hopkins-Colles test. Guanidine group or guanido group is a group present in arginine, and for this the name of the test is Sakaguchi test. So you can say Sakaguchi test is specific for guanido group of arginine. And phenolic group के लिए, phenolic group is present in tyrosine and the test is Millen's test. This is also a question which has been asked in the exam. Millen's test is specific for phenolic group of tyrosine. And Hopkins-Colles test is a specific test for indole group of tryptophan. Right? So the answer is B. Yes, very good. All of you know the answer, right? Then again a very simple question and a very important question. Let me see how many of you can answer this. L-captonuria, an inherited metabolic disorder, is due to the deficiency of. Very important question. L-captonuria में the deficient enzyme is yes. Again, you have to make one more flow chart. Proteins may, if you have to remember proteins, what you have to do is you have to write the name of the deficient enzyme, name of the disorder. So if I talk about L-captonuria, always remember the enzyme is, yes, very good, Shivam and Vishnu, homogentisate oxidase. Very, very important. And this homogentisate oxidase, what is happening is, this homogentisic acid or homogentisate has to be converted into malonyl acetoacetate. So what happens is, if this enzyme is absent, what will happen first of all? There will be increased concentration of homogentisate, and this homogentisate will be converted because it has to be oxidized. If it is not being oxidized by the enzyme, it will be oxidized when left open. So it will be oxidized to form L-capton type of substances. And the most important clinical feature of this is that urine turns black on exposure to air. Turns black on exposure to air because it forms L-capton type of substance. So the answer will be C. Then moving on to the next question, again a very important question. Which of the following enzymes provide a link between glycolysis and citric acid cycle? Always remember, let me see who all can answer this question. सबसे पहले, what is a link reaction? Link reaction is the one which is linking. किसको link करता है? Glycolysis and TCA को. And you know that glycolysis का end product is what? Glycolysis forms pyruvic acid, isn't it? And TCA, yes, very good. The answer is PDH, correct. Yeah, all of you know the answer. And TCA के लिए it starts from acetyl coenzyme A, isn't it? So we have to focus on that enzyme which will convert pyruvic acid to acetyl coenzyme A. This has to be a link reaction. Again, oxidative decarboxylation catalyzed by PDH. And always remember, I am mentioning it again and again, this is a very, very important, this is a high yield question in fact, because there are so many things which are actually focused on this PDH. One is, PDH is an example of multi-enzyme complex. Second is, PDH consists of B1, B2, B3, B5 lipoic acid multivitamins for its reaction. And the most important one is TPP. And it has to be strictly irreversible. So the answer is simple, PDH. Yes, correct. Then moving on to question number 16, again a very important question. Which of the following is not a characteristic feature of allosteric enzymes? This is a very important question. I can see some other students also very good. Anonymous, okay. And Ananya, okay. C. Always remember, whenever we talk about my allosteric enzymes, the most important distinguishing feature is they will never follow Michaelis-Menten kinetics. Yes, just remember this question by heart. They will never follow Michaelis-Menten kinetics. They are multi-enzyme complexes, we all know. Presence of modular site is there, we all know this also, and gives sigmoidal shaped curve. It always gives, because if we see the influence, suppose if I talk about Michaelis-Menten, Michaelis-Menten has a hyperbolic curve, right? But if we talk about allosteric mein, if it is helping, it is like this. If it is not helping, feedback inhibition, it is like this. So what is this? This is a sigmoidal curve. So we can say it will this allosteric inhibition or modulation will always give a sigmoidal curve. And since it is different from Michaelis-Menten kinetics, this will be the answer. Then moving on to the next question. Again, this is a very important question. Your patient's medical history says that she has von Gierke's disease. Obviously, in the first question only I mentioned about von Gierke's disease. She is missing which enzyme? And what is the function of this enzyme? First of all, tell me the enzyme deficient in von Gierke's disease is? Yes, anyone? Vishnu, Jyoti, Anonymous, Priyanka, Suvam. Very simple question. A patient who is suffering from von Gierke's disease will have which enzyme deficient? First question may I have discussed the same thing. See, in von Gierke's disease, yes, very good. Correct, Vishnu, right? The enzyme deficient is glucose 6-phosphatase. Yes, very good. And which converts glucose 6-phosphate to glucose? Simple, because this is the reaction. Glucose 6-phosphate will not be converted into glucose. That is why there is increased concentration of glucose 6-phosphate, and I told you it is diverted to form what? So it is glucose 6-phosphatase, right? Yes, the answer is A. Very good. This is how the questions are asked. So if you know the basics, you can easily attempt your questions. Then question number 18, again a frequently asked question. A competitive inhibitor of an enzyme. देखो एक क्वेश्चन आता ही आता है between different type of inhibition. One is competitive inhibition, non-competitive inhibition and uncompetitive inhibition. Whenever we talk about competitive inhibition, always remember, I'll just give you a flow chart. Let me see who all can answer to this question. This is a very simple question and most frequently asked question. Whenever we talk of competitive, competition is there. Competition किसमें है? Between the inhibitor and the substrate. So I'll just make a flow chart. I'll just write it here. See, 3 type of inhibition are there: competitive, non-competitive and uncompetitive. Yes, correct. Your answer is correct, Jyoti. It's A. So if we talk about Km, and these are the 2 things, yes, very good. These are the 2 things which are changed. So if we talk about Yes, very good. If we talk about competitive inhibition, Km will increase because the affinity of the enzyme with the substrate will decrease, right? And Vmax will be unchanged or it will be same. If we talk about non-competitive inhibition में Km will be same but Vmax will decrease. And if we talk about uncompetitive inhibition, Km and Vmax both will be lowered. So this chart again you have to remember. So if this type of question is asked, again when this chart is in your mind, you can easily attempt your answers. So if we look at this, the answer will be simply A. Right? Yes, correct, Priyanka. So in competitive inhibition, always remember Km will always increase, whereas Vmax will be unchanged or it will remain the same. Then moving on to another very important question. Which of the following is not a post-transcriptional modification of RNA? Now let's see how many of you can answer this question. The options are splicing, capping, polyadenylation and glycosylation. What will be the answer? सबसे पहले what is this post transcriptional modification? Post माने बाद में. किसके बाद में? Transcription के बाद में, right? We are modifying RNA because ये जो, yes, very good. Glycosylation will be the answer first of all. Always remember, this is a very important question. The RNA so produced from DNA, it is, what it is known as? It is simply known as hnRNA. No, Rani, the answer will be glycosylation. I am coming to that. You just remember this. This is a very important question. This hnRNA is converted into simple messenger RNA. There are 3 processes. 5' capping means we are attaching a cap. Cap of what? We are attaching a cap of poly G. GGG is written. Then we attach a tail. So it is tailing. Tailing is done by poly A. Okay? A is there and then it undergoes splicing. Means I'll just show you the structure. It's like this. 5', 3'. 3' pe A will be added and here GGG will be added. And say this is the intron. Right? And it will be like this. So what we get is, we get messenger RNA like this, which is shortened now. 5', 3'. And the question is, glycosylation का मतलब क्या होता है? Attachment of carbohydrate. We are not attaching carbohydrate. We have nothing to do with carbohydrate. Poly G capping and poly A tailing is just done to protect and stabilize this mRNA. Right? So the answer will be glycosylation. Sagar, beta, we are discussing question number 19. Pyruvate carboxylase we did in some other question. Here we are discussing about post-transcriptional modification. Okay. So glycosylation is never a part of PTM. Then the last question. A 20-year-old woman presents with progressive palmoplantar pigmentation. X-ray spine shows calcification of the intervertebral disc. On adding Benedict's reagent to urine, it gives greenish-brown precipitates and blue-black supernatant fluid. What is the diagnosis? A very interesting case and a very simple one. Again, in this you have to just pick the keynotes. Let me see what will be the answer. Just give it a try. इसमें you have to focus on calcification of the IV discs, and second is you have to focus on the biochemical finding. They are saying that Benedict's reagent, when it is added, it is giving greenish brown precipitates and blue black supernatant fluid. So what will be the diagnosis? Pigmentation is also there. No, it won't be phenylketonuria, because see, first of all, let me just tell you the answer will be L-captonuria. Now, why L-captonuria? Because just now I told you that L-captonuria में the deficient enzyme is homogentisate oxidase. Okay? Homogentisate. No, it won't be A. I'll just tell you the reason. Homogentisate oxidase. Right. Phenylketonuria may always remember the yes, very good, Shritika. Answer will be B. In phenylketonuria, the defective enzyme is phenylalanine hydroxylase. Okay. In tyrosinemia type 2, the deficient enzyme is transaminase. And arginosuccinic aciduria, this is an enzyme of urea cycle in which you can say arginosuccinic acid is given out, and the deficient enzyme is arginosuccinase. This is different. I'll just write urea cycle. Now, if we look at this phenylketonuria, if you see, it converts phenylalanine to tyrosine. The enzyme is phenylalanine hydroxylase. This is absent. Increased concentration of phenylalanine will be there. Here the most important clinical manifestation will be mousy odor in urine. Matlab, if a child is suffering from phenylketonuria, his diapers will give the smell of this mousy odor of urine. ये क्यों होता है? Because increased concentration of phenylalanine is converted into phenyl acetate. And this acetate gives this characteristic mousy odor. ठीक है? अब यहाँ पे the reaction is what? Homogentisate. This is the reaction, no? Homogentisate is being converted into mellylyl acetoacetate. And it is very acetoacetate. It is a very interesting feature that this is absent. Just now I told you. So there will be increased concentration of this homogentisate, which will be converted into L-capton type of substance. And if you see in the finding, when we add Benedict's reagent to urine, it is giving greenish brown precipitates and blue black supernatant fluid. That is what I told you, that the urine turns black on exposure to air. And Benedict's reagent, it is doing the oxidation. And Benedict's reagent can easily combine with this homogentisate because it has one reducing end, right? So it will give a positive Benedict's test, but again, you might ask me a question that Benedict's test is for reducing sugars, isn't it? But if you see the color in Benedict's test, it is red. And here the color is greenish brown. And whenever the color in urine is green, very less, traces of glucose. That is what GYOR, G-Y-O-R. That is why we say Benedict's test is a semi-quantitative test. If the urine shows brick red color, we say the amount of sugar is high. But here the color is greenish brown, and which is turning blue-black on oxidation. This is one reason. And second reason is calcification of the intervertebral disc. Because what is happening is, ये जो L-capton है, this L-capton forms ochronosis. It leads to ochronosis. Means there is hardening. Wherever it is present, there is hardening of the structures, which results to this. Right? So today we discussed 20 questions, high yield I should say, and most frequently asked questions of biochemistry. So I hope the explanations of the question is clear to all of you. If you guys have any problem, you can ask me. And this is how you have to prepare. You got my point? Because biochemistry, I admit, it is a volatile subject, but it depends on how you prepare this. and start memorizing the things. If you start memorizing the things once, twice, thrice, I can give it to you in writing, you will never forget this subject. Right? So if you have any confusion, you guys can ask me now. Ritika, Isha, Sagar, Vishnu, Jyoti, whatever questions we discuss, are they clear to all of you? Right. So we will be discussing more questions in the upcoming sessions. So let's wind up the session. Shall we wind up the session? Shall we wind up? Or if you guys have any question or query, you can ask me now. Okay, so thank you so much for patiently listening to my lecture for 1 hour. And I hope I was able to solve most of the questions, most of the problems in this subject. Right. Thank you so much. Good night. Okay,